There are a variety of current treatment options for anxiety disorders that can significantly improve your quality of life. Two of the most popular are medication and psychotherapy. Of the various types of psychotherapy, experts agree that cognitive behavioral therapy, or CBT, is one of the most effective for treating anxiety disorders. Cognitive behavioral therapy is a two-sided technique for treating anxiety that focuses on cognition, the way we think, and behavior, the way we act.
So I'm going to put my hands in here and grab some of these. Now, would you feel comfortable doing the same thing yourself?
Not really.
Not really? Okay.
Cognitive behavioral therapy is based on the idea that anxiety is caused by a person's negative thoughts or beliefs about a given situation. By challenging those negative thoughts, a person can begin to take control of their anxiety.
Our idea with CBT is that we can really work on changing feelings by helping a person change the way they think in certain situations and how they behave in certain situations.
They unpack irrational beliefs in a very systematic way, and then they very often involve creating situations where one emotionally confronts that irrational belief. So they're a double-edged approach.
Yeah, I might have had trouble getting out of the house.
The first half of CBT is the cognitive element. It focuses on changing thought patterns that may be preventing a person from overcoming his or her fears.
I sometimes find myself, reluctant to use a public washroom, or I might steer a little clear of a garbage can on the street.
So with that cognitive component, we want to understand how the individual views those threatening situations. We want to understand their views and why it seems so dangerous to them, and then kind of challenge them on that.
We focus a great deal of attention on what somebody thinks about in situations where they're feeling anxious. We're not just paying attention, though, to those immediate thoughts. So what runs through your head when you're in the situation?
If you kind of predict how tough this is going to be, what number would you give it?
Maybe a 4.
About a 4, so not too terribly bad.
Right.
Okay.
The second component of CBT is the behavioral element. One of the most effective and proven methods is exposure and response prevention therapy, or ERP. It focuses on helping individuals cope with their fears by slowly coming into contact with objects or situations that trigger their anxiety.
It's kind of a mechanical spider, so I'm going to show you that again, that I can make the legs move and everything. So how does that feel when you see that?
I don't like that.
You don't like that?
No.
Okay. The exposure part is really taking the people and putting them in the situations. And it's called exposure and response prevention because the response prevention part is really not having people do their rituals or their typical behaviors they would do to avoid that situation, but to stick with it and stay there until your anxiety level is at least half of what it was when you started.
Maybe 5 or 4. 10?
A 10. Okay, so this feels about the worst you've ever felt in your life.
Okay, 8.
Okay, because I would think a 10 might be being on the elevator, right? I often do the exposures right next to the person because if it's going to hurt them, I want them to know that it's going to hurt me as well.
Okay.
Exposure and response prevention therapy may not be effective or appropriate for everyone. Some patients might respond better to other, less common types of cognitive behavioral therapy. These include dialectical behavior therapy, which is usually used with individuals who harm themselves. Self-instructional therapy, which encourages patients to teach themselves how to cope effectively with difficult situations. And schema-focused therapy, a treatment based on the idea that negative thoughts and behaviors are rooted in past experiences. A course of CBT usually lasts around 12 weeks. It is often conducted individually, but may also take place in groups of patients with similar symptoms. CBT can also be used in conjunction with drug therapy.
I don't ever talk about a cure. What I do talk to people about is I can teach you skills that you can use throughout the rest of your life. I want them to take these skills and I want them to move on and take what they've learned and go apply it to everything.
We've got good scientific evidence that these treatments do the trick. These folks can go from being very debilitated to being able to function as if they really didn't have the disorder.
Whatever therapy you and your doctor decide on, it's important to continue your treatment as directed, and to remember that, like many other illnesses, anxiety disorders can be managed.